Hi, my name is Charlene. I will be diagnosing today. Do you mind if I ask a few questions?
Yes, sure.
Okay, so what is the patient's name?
Miss Jonathan? She's Safia Abdullahi.
Um,
Her name is
I'm
Safia Abdullahi.
Safia?
Yes.
Okay, how old is she?
1 year.
1 year? Okay. Does she have a parent or a guardian present, or is it just her?
Yes, she does. This is the mother.
Okay. So she's 1 year old. Could I ask the mother a question?
Yes, sure.
Um, what does she do for a living? And does she have a spouse?
Why me aikin ki kuma kina da aure? She is married and she's not gainfully employed. She's a full-time housewife.
Okay. So could I ask a few questions about why her child is here?
Okay. Me kawo ku asibiti. She has fever, convulsions, and vomiting.
Okay. And is the fever coming and going, or is it pretty continuous?
It comes and goes.
It comes and goes.
Yes.
Okay. And you said vomiting?
Yes.
Okay. Could we take her temperature?
Yes, with the temperature she came out says 38.7. When we took the
38.7.
temperature, yes. Yes.
Okay. So I would like to run a blood smear for malaria to check for malaria. And I'd also like to run a blood culture to check for typhoid because she said she is vomiting. And I'd also like to check I would also like to run a full blood count to make sure there's no anemia. Is she a bit pale?
Yes, she is pale.
She's very pale. Okay.
Yes.
So yeah, I'd like a blood smear to check for malaria, a blood culture for typhoid, and a full blood count to check for hemoglobin levels.
Okay. So, what do you think your diagnosis is?
Could I get the results for the test, please?
Okay. The hemoglobin is 4.3. That is 13%. PCV is 13%. Hemoglobin is 4.3, and we don't have the full blood culture. It's still in the lab. It's under process.
Okay.
And the malaria parasites are 2 pluses.
2+. Okay, so she
Yes.
has a moderate case of malaria. I'm not too sure on typhoid, but she does have a severe case of anemia, probably from the malaria. So what we'll do is we'll probably, well, do you think it's a very complicated case of malaria?
Yes, it is because
Yes.
she convulsed twice, so it is.
Oh, okay.
Yes.
So it's probably a very severe case of malaria. So I would probably give
Yes.
her an IV artesunate,
Okay.
and the anemia should lift up with the malaria treatment. But since she has a pretty severe form of malaria,
Yes.
I would suggest a blood transfusion as well. And if that's not possible, since she's quite small, then parenteral iron supplements would probably be best.
But I think
Or
in
is a
this
blood
case,
transfusion?
yes, the blood transfusion is better.
Okay,
because
blood
the
transfusion then?
hemoglobin, the blood volume is low, so she needs
Okay,
transfusion. It's a severe
probably
anemia.
blood transfusion then, and an IVR test needs to treat for the severe malaria. And since the blood culture is not
Yes,
back from the lab, I can't confirm typhoid or not.
yes.
So I would prefer to wait to see what she has before treating that.
Yes.
Excuse me? Um, could you repeat what you just said, please?
Seems like we're having just a little bit of connection issues. I'll give it a second.
Yes, there's a connection issue.
Oh, gotcha. I can hear you now a little better.
I can't hear
Okay.
anything.
Yes, can you hear me now?
Yes, I
Hello?
can. Can you, Charlene?
Okay. Charlene, can you hear me now?
Yes, I can. Thank
Okay.
you.
Anything for the treatment?
I think just for now, blood transfusion and IVR testinate for the malaria, and I would prefer not to treat the typhoid unless it's confirmed she has typhoid. So we'll have to wait for the blood culture.
Yes, amazing, amazing. That's very good. I
Okay,
am
and
impressed that
for
you try to rule out anemia and malaria and anemia. It's very impressive. But what do you think? How do you think you can counsel
um
them on prevention for future to avoid
in
future?
so in the future to prevent for malaria, I would highly
Yes,
suggest to getting a mosquito net to put over the bed, especially at night, since that's when the mosquitoes are
exactly.
very
Yes,
active. And I would also suggest clothing her in like a long sleeve, like pants and a long sleeve shirt to also prevent mosquito bites at night, especially. And for the anemia, if the blood transfusion, if like she's still anemic after like a while after the blood transfusion, then possibly some supplements, but I'm not sure if that's going to be needed. Hello?
you did very well. Hello,
Hello?
hello. Can you hear me, Charlene?
Yes, I can.
Yes. Okay, okay. You did actually do
Okay.
anything. You did very, very job. You did very well. I can't.
Hello?
Hello.
Oh, could you
Hello.
please repeat what you
Can you
just
hear
said?
me? I
I can
said
hear
you did
you.
very, very well. It's a very good job. You did absolutely well. You're going to make a
Thank
very good
you.
doctor in the future.
Thank you.